Welcome to Hot Seat MD, a case conference review. The directions are simple. When the case appears, I will ask you to pause your media player. Then describe the study type and findings, give a brief differential diagnosis, and then check out the fast facts for additional information. Now pause your media player. This single axial CT image of the head reveals crescentic shaped extraaxial low to iso-attenuation in the high parietal region bilaterally. Your differential diagnosis should include subacute subdural hematoma and, less likely, subdural empyema. Now pause your media player. Now pause your media player. Axial post-contrast and FLAIR MR images reveal multiple increased T2 signal, ring-enhancing lesions in the brain. The differential diagnosis here should primarily include multiple abscesses and metastases. You may also add subacute infarction, demyelination, and radiation necrosis, although this really could represent any of the above. History is crucial. Now pause your media player. Axial and sagittal T2 weighted MR images of the lumbar spine reveal soft tissue extending from the L5-S1 intervertebral disc. This fills the lateral recess on the right and extends inferiorly, posterior to S1. The diagnosis here is paramedian disc extrusion. There really is no differential. Now pause your media player. Now pause your media player. Axial and coronal post-contrast MR images of the posterior fossa reveal an enhancing mass in the right internal auditory canal. The differential diagnosis here should include vestibular schwannoma, also called an acoustic neuroma, or a meningioma, although these... Now pause your media player. This non-contrast axial CT image demonstrates a large cleft in the cerebral parenchyma extending from the lateral ventricle to the calvarial region on the left. The differential diagnosis here should include open lip schizencephaly, focal cortical dysplasia, and porencephaly, although this should be lined by white matter, not gray matter. Now pause your media player. This axial T2 weighted MR image of the spine reveals a well-defined fluid intensity right neural foraminal lesion. The differential diagnosis here should include perineural root sleeve cyst, and this is the common typical appearance of this lesion here. Your differential can also include nerve sheath tumor, although you would be shown an image of the lesion enhancing in this case. Facet synovial cyst can also be mentioned, although this lesion should definitely abut the facet joint, and it is questionable if it does it here. Now pause your media player. Non-contrast axial and coronal CT images through the facial region reveal a linear lucency with soft tissue swelling and gas involving the nasal septum, with deviation of the septum to the right. Differential diagnosis should include nasal septum fracture, and in the setting of trauma, there is no real differential here. Otherwise, nasal septum perforation or erosion could be mentioned, although this case has no destructive change, making this diagnosis unlikely. Now pause your media player. Now pause your media player. Post-contrast axial and coronal MR images through the orbital region demonstrates enlargement of the muscle belly of the left medial rectus muscle and, to a lesser degree, the inferior rectus muscle, with relative sparing of the tendons. The differential diagnosis here includes thyroid-associated orbitopathy, or ophthalmopathy, and orbital pseudotumor, which is not likely in this case, as this usually involves the tendon as well as the muscle belly.